Loud and proud.
Yeah, I am loud and proud.
The man.
Right.
The man.
So you know what I'm talking about. Okay, today I'll be talking about whether or not a bachelor's degree of science in nursing should be required for entry-level nursing. And before we begin, a little disclaimer. The message is intended for students and people with interest in going into the healthcare field. So go over my outline. We're going to go over what is a nurse, what you need to be a nurse, the question, pros of having your bachelor's degree, cons of having your bachelor's degree, and then we're going to conclude. Okay, what is a nurse? There are several different types of nurses, but the main responsibilities of nurses are performing physical exams and examining health histories, educating patients on their health issues and precautions, giving medications and treatments, interpreting patient information, and making decisions, and they are overall very involved in the well-being of the patient. As you can tell, nurses are a crucial part of healthcare, and the demand for nurses is getting higher every year. The Bureau of Labor Statistics projections determine that registered nursing is listed among the top jobs to grow throughout 2022. The workforce is expected to increase about 526,800 open jobs, or 19%. This is not including the predicted 525,000 replacements needed for current positions. And now that we know this, we can talk about what you need to be a nurse. And even though the job is a little less stressful than that of a doctor, you need to be caring, educated, and responsible to ensure the absolute safety of all patients under your care. You can be an RN with an associate's degree in nursing, also called an ADN degree from a community college, or a higher Bachelor of Science in Nursing degree called a BSN that you can obtain from a university. To obtain an ADN degree, it is a 21-month program, typically at a community college, and to obtain the BSN degree is about 4 years of schooling at a university. In nursing school, you get a hands-on experience of being a nurse and learn the skills and qualities of being a great nurse. Both of these degrees make you eligible for the NCLEX, the exam that determines whether or not you become a registered nurse. And now, questions form. Should a BSN be required for entry-level nursing? The pros of having your BSN degree are that hospitals are now starting to prefer BSN degrees, educated nurses. There's a wider array of specialties. For example, a BSN RN could be a public health nurse or a nurse educator. A public health nurse is focused on the health of the community. They do things such as set local priorities for health-related interventions, design and implement health education campaigns, and disease prevention activities, such as immunizations and screenings, and communicate with state and federal authorities to improve access to health services or underserved communities. A nurse educator educates incoming RNs and LPNs in their place of practice, such as a hospital. Another pro is better salary. Those with ADN degrees make around $66,000, and those with the BSN degree make about $75,000. Another very important pro is safer patients. Hospitals with more BSN RNs have higher mortality rates. Hospitals that employ larger numbers of BSN prepared nurses have lower patient mortality rates, according to Linda Aiken, PhD, RN, and Director of the Center for Health Outcomes of Policy Research. And 10% increase in the proportion of nurses with BSNs was associated with a 7% decrease in patient deaths. She found in a study found published in The Lancet. A 10% increase in the number of BSN prepared nurses reduced the likelihood of death by 5% in another case. And I also have perspective from a nurse holding both an ADN and BSN degree who also worked at the University of Hawaii School of Nursing. In her experience, she found her associate's degree program was very hospital-based and seemed like she was in a trade or vocational school program. Her explanation of the BSN program included how it was more theory and community-based. They were very focused on critical thinking, leadership, versus the skills associated with being a nurse. She included advice for incoming applicants to the nursing program, in which she mentioned that they should intend on attending a BSN program, whether it's their first point of entry into the profession or even if they do so after getting their ADN. And now, the cons. There really aren't any cons. Besides, it usually costs more to get your bachelor's degree than your associate's degree. and the extra cost is, and the seemingly extra schooling, even though they both end up being about the same amount, is what keeps people from going to the BSN program. So really, there isn't any reason why you shouldn't do it. Okay. And to conclude, I hope this served you all to help you take a new perspective on the different education paths for nursing and use them to determine your own. Thank you. That is all. Questions that they would like answered?
No!
All right. That's it.
I have a question.
Why did it say AMD and ABN?